computer. Okay, awesome. Yeah, most of you guys know who we are, but I'll introduce myself and I'll have Ben introduce himself. And so my name's Stephanie. I am have been a physical therapist for, gosh, almost 20 years. It's crazy. I feel like I am not that old. But I love figuring out how the body works and where and just why things happen, and just always am questioning things. And there's been times in my life where I've had a lot of issues, knee being one of them. I've had a couple of knee surgeries. One of them I wish I never would have had, again, but it gives me my experience of why I do this and why I really try to help people prevent from having to go down the same paths that I have. But the frustration with going to a doctor's office and them not really having the time to sit down and listen to you, to just wanting to rush into doing medications and drugs. I mean, I had the exact same experience, and I just kind of got frustrated with the whole process and the whole system, which is why I've set up my office the way I have, to really sit down and spend time with people and understand really where the source of everything is coming from. And like I said, I've had a couple of knee surgeries and have always had knee issues, especially on this right side. And there's been times where I'm like, God bless, is this going to be the one that's going to get me down, that I'm not going to be able to do the things that I love to be able to do? Am I going to have to not be as active as I used to be? And really going down those path of those fears. And I'm a physical therapist, so if I'm having these fears when I have some issues, I know it's got to be 10 times worse for my patients, because they don't know what to do and how to take care of themselves. And I know what they get when they go to the doctor's offices, and the frustration that happens there. So I'm going to have Ben introduce himself.
So my name is Ben. I've been a physical therapist for actually 5 years at the beginning of May. I really got into physical therapy because I was having knee issues. I had an ACL surgery, and thankfully I got put with a great physical therapist that really inspired me to kind of go down that route and pursue that as a profession. So I've known I wanted to be a physical therapist since I was like in high school. But yeah, I mean, it's with knees. I mean, it's those conditions seem to pop up over and over again, but it's knowing how to manage it. And I think when I got out, it was really I was really shocked at how little time I was actually able to spend with my patients, and that's why I kind of ended up, transitioning over here to come work with Stephanie.
Awesome. Let's get into a little bit. Let me see. Perfect. So some of the things we're going to talk about are like why pain pills, medications, injections, and surgeries don't often work, why MRIs and imaging leads us down to more unnecessary procedures, what healthcare providers miss in helping you get back to living your life and staying active and mobile. So those are the main topics that we're going to talk about. And this is kind of how we can help. I always like to say where the side of the pain is often not where the source of the pain is. And I can give you, a perfect example of someone that had come in not too long ago with some knee pain. And sure enough, when we went and did a whole movement screen and figured out like how, where everything was coming from, it was actually coming from the hip. And that was really what was affecting the knee. There was nothing around the knee that was actually a problem. The knee was moving well. The strength around the knee was moving well. But there was more issues in the hip that was creating that. And so often in our healthcare system, we tend to go to the side of the pain, and it's the only place that we focus on. And that's when we do imaging, and that's all the doctors focus on. And we're missing the boat. Our whole body is connected. The other thing we're going to talk at the end is stay tuned to the end, because we're going to have a special offer on being able to talk to one of our specialists to get a little bit more specific about what's going on with you, to kind of help you make a better decision about your health. So stay tuned to the end for that. So these are some of the common knee pain, causes of knee pain, common causes. There can be decreased mobility in the hip and the knee. I'd even add the back. I know we have back pain on there as well. There's muscle imbalances, movement habits that we create that create the problems. There's muscle tightness within the hips, IT band, hamstrings, quads, and then there's back issues. You'd be shocked at how many how many knee issues people can have that's really due to the back. So it can be any combination of this, and we'll talk a little bit more later on like why people miss this, because a lot of times healthcare providers will only focus on one thing. You go to get a massage done, and that's only one piece of it when you're not looking at the whole big picture. And that's why so many people suffer with knee issues and other issues without results. So why don't you, Ben, get into a little bit about like why medications and injections don't work?
So there are, three big ways that we really experience pain. There's kind of the mechanical part, which is more of those musculoskeletal aches and pains that kind of come and go. And then thermal pain, which would be like if you burned yourself, or if you're like me and you went out on Sunday and got sunburned. Chemical pain is more like that inflammation type of pain. Right after an injury, that's really common, but that should go away within probably those first few days. And that's more of that, burning, aching pain that just you can't get away from. You can't change your position to make it go away. So really, when we see why medications and injections don't always work for you is because, if something's mechanical and you're just trying to treat it with the chemicals that are in these injections or over-the-counter medications, it's not going to work because the problem isn't chemical. So if you're in those initial phases, then yeah, a medication might help you take away that kind of pain you can't get away from, like the burning pain. But from a mechanical standpoint, it's not going to really do much for you.
Yeah, I'd say also too, a lot of times that's the first defense that doctors want to give you is, let's give you pain medications, inflammation, anti-inflammatories, and a concoction of something, or let's just give you an injection. So if you're only treating the pain with the chemical way and you aren't treating it from a mechanical standpoint, then that's why the pain returns. And so that's why a lot of times if you look at the research on actual like injections, I was shocked when I was doing a lot of research when I was going through some of my higher level education with Mckinsey, was that every research I was looking at with injections that 6 weeks down the road, they were not any better than without the injections, and actually sometimes worse, because you feel better because you have the injection and the chemicals that are in there, but then it comes right back again. And because you just like went back to your normal activities when there were some other issues that were going on, you can feel worse. And so then you get into this whole pattern and you get frustrated, and the doctors are like, well, surgery is the only other option that we have. You go to cookie cutter places and they don't really address the problem. They're just kind of treating symptoms. So that's what we have to figure out. There's times when we've told patients that you probably need an injection first because you're so inflamed, and then you'll come back in and then we can work on the mechanical part of it. But more than likely, most everything, if you have an injury and you aren't sure what you did to create that injury, there's always something that you can do. Like that usually is something that does not require surgery or anything else. Like you can get resolution from what's going on, as long as we can figure out where the source is coming from. So let's go into like why surgeries lead into more surgeries. You want to start there?
Yeah. So usually I'll use the example of like a back. So usually people will end up round of injections, those don't work, and then we end up going to kind of the discectomy, and then we end up going to a fusion. And really that's because we don't actually get down to the source of why that thing was happening in the first place. So you look at from a knee perspective, you start doing the round of injections, doesn't clear up, keeps coming back. Then we end up going to, well, let's just do a clean out of the knee. We'll do a meniscectomy, and just you got some gunk in there, we got to get rid of that. Then we end up doing, oh, well, that failed, 2 years down the road. Now we need to do the total knee. But really, one of the big issues was that we never found out why that was reoccurring in the first place. So that total knee isn't going to necessarily make a huge difference for you. It's just going to be a tough rehab. and it may give you some relief, but it's a lot of surgery to undergo with, I mean, you have a high chance of complications. There's, all the issues of blood clots, things like that. So it's worth it to try to explore some conservative options before you jump the gun and go to that surgery.
Yeah, when you look at the research on like when they do a clean out, which is so common, you see it all the time, you actually have a worse outcome a year down the road because now you just messed with the knee. The more you mess with the knee, the more you're going to end up having some arthritic changes that go on. Excuse me. And so it's not any better than just like general exercise. And when you get to a place that actually can understand what's going on, that's definitely going to be better than general exercise, and you can get the outcome that you want. They have research with like total knee replacements. It's pretty crazy. A lot of, our training, Ben and mine's training, we've gotten trained in this like Mckinsey theory. Which is an evaluation process, which is pretty fantastic on trying to figure out how to get to the source of what's going on. But they took people that were in line to have a total knee replacement, and they went through a Mckinsey evaluation, and they put them into two categories. One, if their knee wasn't moving very well, and they noticed that they could get some quick results with some better movement, then they showed them some self-mobilizations that they could do to basically get them back. And then they put them in another category. If they didn't see results with that, they put them in the general strengthening category. Of those people, 40% of the people in line for a total knee replacement had full resolution, and they had full resolution in not very many, it was like, 3-4 weeks, and they were doing so much better and back to their activities. 40% of the people in line for total knee replacement. And so you've just got to be careful. And we've had other patients that have come through with that needed surgery, or so they were told they needed surgery. They had they were supposed to get a total knee replacement, and they weren't really sure, and they came in just to get kind of one of our sit down, have a talk with a physical therapist. We do some of these things for free when we have spots during the week open up. And literally her complaint wasn't that she was in so much pain. Her complaint was that she was so tired. And I said, okay, let me ask you this question. If you get this surgery, how do you feel like that's going to help you with your fatigue? And she said, I was wondering the same thing. And she's back to walking now and doing things that she never could do. Like, she was literally so fatigued that just going out to go do one activity, one errand, it took her all day just to prepare to go out and do that one thing. And now she's out and about walking for exercise, out with her husband. So if you're in line where the doctors are saying that you need to have surgery, then definitely reach out to us. Let's have a conversation. Let's see if that's even necessary. I can tell you from my office, the way I've been doing it this way for 3 years now, we've only sent like 4, maybe 5 patients to surgery, and that's it. That's how many people we've been able to help prevent from having to go into surgery. So this should be your very last option. And there's times, yes, we need to have surgery. There's times I'm like, I agree, you need to have it, but it's far less, it needs to happen far less than what it does right now. So let's go into MRIs. Why don't you talk a little bit about that, Ben?
So with the MRI, I mean, when they take it, it's gonna catch everything. So it doesn't always show us exactly what the source of your problem is. So it's really common to just have a torn meniscus on MRI. I mean, probably 50 to 60% of MRIs, you're going to have that, especially as you get older. As we get older, you're going to see varying degrees of arthritis. That's just common. I mean, it's like, you can think of arthritis as like having, wrinkles on the inside. Like, it's just going to be there. And it doesn't always correlate with why you're having your symptoms. So that's why it's so important to actually, try some conservative management before, jumping the gun and just going right off what this MRI is saying, because oftentimes it's a little bit misleading.
Yeah, and I'd even take it a step farther and just don't spend your money on the MRIs, and then come to someone that actually can help you, because you might as well get a solution to your problem and understanding of what you can do versus just taking a picture. And it's, I mean, if you look at the research on MRIs, you know, this is, if I took all the MRI research and I put it all together, there's a lot. And I always like to equate it to, like, if I took like 100 people that had no pain whatsoever, fully functional, you know, they play baseball or they can run or they can jump, like they have no problems whatsoever. 60 to 80% of this, of their injuries, 60 to 80% of them will show something. And that's like what Ben said. It's like, you know, as we get older, we get wrinkles on our face. It's just a part of aging. And so as we get older, some of these things that we're finding, the degenerative changes, the meniscal tears, the rotator cuff tears, the arthritis, those kind of things are things that just happen as we get older. But because we're hurting, all of a sudden we take this picture and it says, oh, you have this thing, but it may not be the case. And I don't know how many times, I mean, if you take people that are fully functional, no pain, like they even have arthritis. Like arthritis is not something that you should be fearful of, like, oh, I have arthritis, there's nothing I can do. That's not the case. Is your pain really coming from arthritis, or is there something else that's going on? More than likely, there's something else that's going on, because the arthritis, it's very rare that the arthritis is what's creating your problems. Now, there are sometimes then it really is. I mean, people are bone on bone. You can hear grinding, but you just don't see that often. And there's almost always something that you can do. So let's go into some of the things that other healthcare providers miss. And a big one is, and I know Ben touched on this a little bit, was lifestyle changes. Like, what are you doing throughout the day that's creating your problem? So similar to, like, I'll say if you're a runner, like, how are you running? Is there something going on somewhere else that is creating this problem that we need to address? Maybe we need to address the shoes that you're wearing that are creating some of the problems, because maybe your shoes are 5 years old and you should be getting a new pair of shoes. Maybe they're the wrong pair of shoes. Maybe there is things that you're doing throughout the day that's creating some of your problems because you're at a sitting job and your knees are always bent, and we've got to kind of adjust that a little bit because that's what's creating some of your problems. So there's things, you know, this is where you get into those movement habits that we've got to figure out. So that's where some of those lifestyle changes come into play. I always like to use it like a finger analogy. You have a finger and you pull it back and you pull the finger back. You know, it doesn't matter what strengthening and what injections and massage. If you don't fix pulling the finger back, you're going to continue to have the problem. So I always tell people there's like 3 phases of care. And the first phase is, let's get the pain under control. And a lot of that is making sure that you have the mobility in all the areas that we need. And then you can go to the stability piece, and that's the strengthening piece. If you don't get the mobility piece figured out and you go straight to strengthening, you're going to have issues. You're not going to get better. And then you have that, okay, now we have this, why did this happen? Why did you get this pain in the first place? And that's going into those movement patterns and habits and things like that we've got to address so that you'll know how to take care of this and manage this. And then often healthcare providers, we talked about this a little bit, only look at the side of the pain. So I always say where the side of the pain is often not where the source of the pain is. And so we've got to look at the whole body. You know, we've got to look and see, you know, I had an issue that Ben was working on and it was in my knee, but my ankle on that same side wasn't moving very well. And that was creating a problem. And so we had to get my ankle actually moving so that, because they're all connected, so that it could help with my knee issue. And people don't look at that. Maybe you have a hip issue that is affecting the knee. Maybe it's a back issue. So you've got to look at the whole picture. And then I always say people often only look at the injury in one way. So you go to a massage therapist and they're only looking at the tissue, but they're not looking at the whole big picture. They're not looking at the mobility. They're not looking at strengthening. They're not looking at movement habits. You might go to a PT and they only look at the site of the pain and they only work on strengthening. And that is an issue because you've really got to look at the whole picture to really get people back. Is there anything else you want to add, Ben?
Yeah, I think really what lets us do this a little better is just that we have the time to do it. So like a lot of these offices that you go into, especially if you go in, you know, and you see an orthopedic surgeon, they are seeing like 30 people a day. So they are spending, you know, they have 5-10 minutes with you tops. They're looking at your MRI and they're on to the next room, you know? So I think us being able to sit down and ask the right questions really, because a lot of times it's just putting all those pieces together, because I mean, you may just be having back pain and knee pain, and they may not be like, it may not be connecting down your leg, but it could be referring out of your back. And so it pays to, spend a little more time and ask the right questions to get down to the source of that.
Absolutely. So what are some of the big things that we can take from this? Most injuries do not require surgery or medications at all, rarely. Most of the time, your pain comes from somewhere else, or like the source of your pain comes from somewhere else. MRIs and x-rays don't help in guiding the treatment as well as resolving the knee pain. Now, I'm going to put a little caveat on this. If you have fallen and you had a knee pain because you've fallen, there's times when x-rays are needed. We need to make sure that there's nothing that's been fractured, those kind of things. But when you look at them, you're like, oh, my space is really small. There's people that have really small spaces and they function just fine. It's no big deal. So just because you have lower space or there's not much space left does not necessarily mean that, oh, there's nothing I can do. We see stuff like this all the time, and we resolve stuff like this all the time because usually there's something else that's going on. You can make everything more flexible around the knee. If there's some issues there, it's going to give you more space, more movement space to be able to get back to some of the things you do, if that is where the problem is coming from. So see a specialist to help you figure out where the source of the pain is coming from. Really someone that's going to spend time with you, because like Ben said, there's so many offices that have to see 2 and 3 patients an hour just to make ends meet with the insurance world. And when you can really spend time one-on-one, it means that we can resolve the problem much quicker, as well as with much less visits. And with a way better service. And, I always like to tell people, we're like the coach of your body. We're coaching you to get back to the things that you love to do safely. And that's another thing that people also don't do. It's like they resolve the pain and then they say, hey, you're good. But they never really got you back to the things that you love to do. And that's where we come into play. Like, we get you back to the things that you love to do so safely, so that you can do that, and then bring awareness around, okay, so these are some things that you're going to notice. We have to manage this, just like if we have a car, an older car, we have to do maintenance on the car so that we can keep it running at its optimal performance. Well, as we get older, we just have to do a little bit more maintenance on our body. And that's where some of the things that we teach you to do, to give you some of those maintenance things so that you can keep on doing the things that you love to do. Don't let anyone ever tell you you can't. Well, if anyone tells me I can't, I just go and do it. And I say, I'll prove you wrong, and I'm going to die figuring it out if I have to. But don't let anyone tell you, don't let the doctors tell you that your life is over, that this is the way it has to be, and there's nothing that you can do. It is just not true the majority of the time. It is just not true. And there's hope that you can get back to living life again and doing what you love to do. You want to add anything else?
Yeah, I think that, it's really about, like you were saying, just finding the source of the issue, nailing down what am I doing throughout my day. And sometimes that's just really hard to identify on your own. And because we're just so stuck, we're living our lives just going throughout our day, and we don't notice these movement patterns that we've created that are maybe, causing some issues. And it may be, something up in our hip that's causing some issue in the foot, or, in the knee, or maybe something referred out on the back. So it's always nice to have, a good opinion and, spend some time and really look at it if you're having some issues.
Okay, so before we ask questions, just want to thank you guys for coming here and listening. And we're going to open up so that you guys can ask some questions here in a second. If you want to talk to us, if you haven't been in to see us, we have opened up a few spots for next week where we can kind of help you figure out where the source of your pain might be coming from. Or maybe someone that has some issues with their knee and you wish they listened to this. We've recorded this so that you can hand this video to them so that they can take a look at it. And we want to help you make a plan and get you back to living life and keeping you keeping the pain away for good. So if you're interested in anything like that, then definitely let us know. I'll be emailing you guys links if you want to sign up for some of those things as well. I'm going to